All right, Dr. Jaban again. This is phase 2 of how to pick your binder. So we already went through talking a little bit about parasite, heavy metal, and yeast. So if you haven't seen that video, it will be up already on our page. So go ahead and go look for that. So we're going to jump right in today talking about after that yeast, next came bacteria. So bacteria like Lyme disease, which drove me into this whole mindset, this whole field right here, because I ended up having all the symptoms of Lyme, going and finding someone who was experienced enough, getting treatment and getting well, and symptoms all fading away. Thank goodness for him. So Dr. Lindsley, thank you. That was years ago now, and now as a colleague, we worked on these protocols together. So bacteria. Biotoxin binder is one of my favorite. It has the NAC in it. It has molybdenum in it, fulvic and humeric acids in it. It is got the activated charcoals, or better yet, bioactive carbons, which is another step up. That's what's inside of it. And it is an exciting product. I've got patients that just can't get away from it once they get on it, as far as the results that they're getting until we get through those protocols. So putting that in there to grab up the die-off from bacteria, because when they die, they release ammonia, and that ammonia then goes into the brain. I have patients that can smell the ammonia. They get blurred vision, they get headaches, they get all kinds of different fatigue or mood symptoms from the die-off. It can be called Herx reactions. It's flu-like. It's like being hungover, okay? So that's when you add more of that binder in there to pick it up when you're using killers to kill off bacteria, whether that be herbal or medication. Binders can be helpful. All right, so that was the B right here. And as we keep moving through, sometimes you unlock the next phase, right? So say we got through bacteria and you unlocked more heavy metal. So then you've got to rotate back into heavy metal binding if you get some of those other symptoms from before on the other video. Again, that metal in the mouth is the absolute most blatantly obvious one, but there are so many more different symptoms there. So again, it could unlock more heavy metal to come out. And there have been studies done, just little studies in clinics from doctors, that will find that they try to chelate out, even IV chelate out metal, and nothing comes out. But then they back up and okay, what is the first step? What is the piece of the onion we need to unravel here? They unravel that piece, and then metal comes out on its own. So that's what this is all about, is knowing when to use the right binders based off of some symptoms. All right, so then you take care of that heavy metal, because we've already talked about that on the previous video. And now, oh heck, here comes mold, here comes those microns that can be absolutely devastating to someone, but they're gonna start coming out. So what we've got to do is we've got to go ahead and use NAC, activated charcoal, bentonite clay. Saccharomyces is another piece, especially if you have some different types of mold microns. That's also on another video. I've got a whole video on binders to use for mold, so go check it out. And then lastly, the Biotoxin binder does incorporate a couple of these. It doesn't have the Saccharomyces or the bentonite clay, but it does incorporate the NAC and the activated charcoal, the fulvic and humerics. I've already said that, so I know I'm beating a dead horse on that one, but these products are so good and so useful in my clinic, and they just come to mind all the time. But mold also has to come out of all of its little hiding spots, so the intracellular spaces inside the cells, the bloodstream. We're talking it goes and hides everywhere. It can be in the sinus. Theories out there that it can colonize the body and then start producing it on its own. So not only do we have to bind these, but we've got to do some things that are anti-fungus to get out of there, fungus mold to get out of the body. And that's a whole nother video on how to treat and work through that and get the body strong enough and optimized to be able to kick it out. But those are some of your binders. And you've got to make sure and support mitochondrial function, liver function, and drainage while you're going through this whole process, because if you don't, it's a miserable long road. So I've got a whole video about how to kind of go through this process of mold, and it also talks about being gentle and slow, and that applies to all of this, right? So more of these things doesn't mean better. Sometimes you do need a lot more, but too many binders can make you just as sick as too many killers or too many toxins, because killers are going to push the body to kill off organisms, and then those dying organisms release toxins into your body that make you sick. Toxicities are already there making you sick. And binders grab hold of toxicity and start to pull it out. But if your body can't process all that, then you get sick because now you have toxicities that were stagnant and stuck somewhere out circulating, damaging new tissue. So make sure you go low and slow, building up, because your body can only handle so much. And once it gets going, you can add more and more and more and keep getting stronger until your extreme sensitive people out there actually can tolerate just about as much as your non-sensitive patients that come in, or non-sensitive clients or people that you know, right? Because there are different thresholds everybody has on their ability to tolerate toxicity, what their liver can and can't do, how well they methylate. So start slow, build up. It's a marathon, not a sprint. Hope this is helpful. If you have any questions, post them below. If you have any thoughts or different questions that you want answered, post them with it. I'm always looking for things to put out there for more content, for more education, because educating you guys is what's going to get you well, what's going to get everyone well, and ultimately make this a better place to live, a much happier place to live when everybody's feeling good. All right. Thank you for watching.